everyone. My name is Katie Brumfield, and I am the Colorado School Public Health Career Specialist. And today I'm talking with Lindsey Wittington, and Lindsay graduated from our program in 2019 with her concentration in epidemiology. Hi, Lindsay.
Hello, hello.
It's so good to see you. We were just talking about when was the last time we saw each other, and it really feels like it was like last year.
Right before I graduated, I was applying for jobs like in March, and I think like I could stop by the office to talk to you about my resume and stuff.
Yeah. How has that been 2019? Oh my gosh.
I don't know. It feels so weird.
I know. Okay, Lindsay, please tell us your current job title and where you work.
Okay, so I am technically called a policy analyst, but I'm more of like a data scientist at my position. So that's kind of like the difference in, my position title versus what I do every day. And I work at the Colorado Health Institute, which is kind of like, it's a nonprofit, nonpartisan, kind of just research institute where we do lots of cool stuff to support public health research and policy making at the state. So it's really, really cool.
And how long have you been with CHI?
So this was actually my first job right out of the program. So I've been at CHI for I think it's almost my 2-year work anniversary in November. Yeah, like it'll be 2 years in November.
Oh, wow. Cool. Can you describe to us what a typical day is, like some of your job responsibilities?
Yeah, so at CHI, it's kind of like I don't want to say like a newspaper, but it kind of is sometimes because we do a lot of work with lots of different stakeholders in Colorado. So sometimes, I'll get requests. So I mostly do data support on lots of the different projects that come into our doors. So we consult with lots of different agencies, if it's like, health systems like Denver Health, or if it's like, a certain committee at the legislature, like we'll work with our stakeholders. And we'll have kind of these like quick turnaround projects where I come in, I get data from public surveillance systems, and I just do all the data analysis on those projects. And so those kinds of requests will come in kind of quickly sometimes. So that'll be kind of the fast-paced part of my job. But then most times I'm just working on, 4 to 5 projects, maybe each week I have like specific responsibilities. I'm building databases. I'm doing fast analysis on specific, data sets of interest, if it's the American Community Survey or like whatever. It's a lot of the, on the ground, like doing a lot of the analysis on these specific data sets. And then also I get to do a lot of writing. So that's one thing that I really love here is I love quantitative analysis, but I also love writing. And I get the opportunity to write blogs about any kind of topic of interest that I'm interested in. So I just wrote a blog about mental health and sleep. So like there's a lot of variety, I think, in my job where I work on specific projects, but then I have like the ability to be flexible and kind of work on whatever I want. I'm also doing a project on overdose deaths that is just something that I was really passionate about and wanted to write a report on. So like I get to write and also do a lot of the math that I learned in my program. So it's really cool. I really like my job.
Where can we find this blog that you're writing?
Yeah, it's going to be published, I think, next week. So it'll be on our website, the ColoradoHealthInstitute.org, or I think we also just kind of like blast it out on LinkedIn and stuff. So it'll be out there. You'll see it.
That's so cool. I like that you get that creativity. And
exactly. That was something I really wanted to do, I think, with public health in general, because I was really STEM, like biochemistry, worked in a lab before I got my degree, my MPH, and I didn't like it. I was like, it's just not as creative as I wanted it to be. And public health is weirdly like a combination of creative approaches, but also research-driven approaches as well. So it's this weird combination of like, you get to do a lot of the cool work that supports these kind of initiatives, but then you also get to do a lot of creative thinking to make things happen. So that's what I really like about public health in general, and then specifically in my job as well.
That sounds awesome. So it sounds like you're a numbers person.
Yes.
And you probably spend the majority of your day behind the computer.
Yes. Yeah.
Analyzing data.
Like in meetings, like a lot of ours too is like where we're doing kind of data planning. So it's kind of like they come to me, we kind of talk through like, okay, so we have to answer questions about aging populations, like what kind of data is out there that can help us answer these questions. So I'll go out and be like, okay, I know that we have surveys or we have data sets on this topic. So I'll like talk through with different people on my teams to kind of sort through like what is the data availability on projects, and then also what are limitations of each data set, and then kind of like me going out there and finding that information for folks on my team. So it's kind of like I'm a data searcher. I go and find stuff and come back with like really cool workbooks and whatever to help people write reports or like do evaluations, like that kind of stuff.
Oh, very cool. Very, very cool. And what system do you use the most?
I do SAS mostly. Yeah, most of my job is in SAS. Like that's kind of the platform that we use. Sometimes I did have the opportunity to learn a little bit of R, but like at our institute, like we mostly just do SAS, which is what I learned at my MPH. So it was like, perfect. I know exactly how to do that. I also do a lot of GIS analysis as well, which I also learned through my MPH. So we just do ArcGIS online and desktop, which I love that stuff too. But yeah, all those things like I already knew how to do coming into this job because of my program.
That's great. That's great. That kind of leads me into the next question is, how did the Colorado School of Public really help you prepare for this career?
Honestly, I think like it was the perfect amount of kind of getting the baseline information that I needed to know, like topic level, like being able to talk about a lot of these things. But then also, I just feel like I learned so many technical skills in my MPH program that really just like made me really marketable when I went to go get jobs. I was like, hey, so I know a lot about substance use disorder because that was like my practicum and I learned a lot about that. But also like, I know how to do, I'm a SAS programmer. I am a GIS analyst. Like I know how to do SQL. Like there's a lot of these technical skills. And even like my epidemiologist background, like doing the math and doing kind of that, like, what are the things that we can answer with the data? All those things I learned in my program and like through my practicum experience at Tri-County Health Department, like it set me up for success to get a job. Like I remember trying to get jobs out of my undergrad and I was like applying. And I was like, I would get one response for like every 30 things I would send out there. And I got responses for almost every job that I applied to after I graduated. It was awesome. I was like, yes, like I have something that like it changed the way that I approached like getting a career. It wasn't just about like, I need a job now, but I could be like more competitive and be like, no, like I have 2 offers, which was what happened when I took my job. I was like, I think this one will be more interesting. And I think this will be a cooler job. So like, I actually was able to pick between a couple different career options, which had never happened before, looking for a job. I was like, cool, like this feels different. Like it was so much more, it was just a way cooler experience, even trying to get a job afterward. Cause even when I didn't get the job, my interviewing and like all these different things that happened between May and November when I got my job, it was really good practice, like leading up to that. And really my practicum experience, I think that was one of the most integral things because my practicum led to like a data consultant job at Tri-County. So like they kept me on for a year that whole time, like during my last year of school. So I had a year of experience working for a local public health agency before I left the program. So that was perfect. And I got like paid, which was cool too for like some of that work. But yeah, like, and he, like my preceptor really helped me find this job. He was the one that actually connected me with the Colorado Health Institute. So like those connections that I made through the program were so integral in me finding a job. Like he was sending me things, like even the people I worked with at my practicum were like, oh, we got an opening, they let me know when there was stuff open or if there was stuff open, at other agencies that they were like, they knew what I could do. And they knew like through the program and stuff, like they knew I'd be successful in these positions. So they were trying to get me a job too, which was really cool. Like that's
amazing. Yeah, that is amazing.
We have this girl that like knows how to do stuff. Like they were connecting me with people that could get me a cool career. So I think that experience was like the main reason I got my job, really.
The professional network you make in public health is very valuable. Very, very valuable.
Really interact with a lot of the same folks too. So like people move around in these different departments, but like you'll start to see the same names and like those connections, you can get new interesting careers. Like they'll connect you with the, CDPHE or they'll connect you with Denver Public Health or whatever. Like all these people really interact a lot. So those relationships, I think, were the most important part of the program, really. Yeah.
Yeah, that's awesome. In your current role, what would you say are some challenges that you have faced?
Yeah, so kind of going back to that, like where it's sort of journalistic, kind of, it's pretty fast paced. I would say at my job as like at a small like nonprofit, like we get a lot of work coming in and coming out, and we have like a smaller staff. And so a lot of it, you'll get pulled in on something really quickly that needs a quick turnaround. So it's like you need to be adaptable to kind of that fast paced environment, because we're kind of like we're a consulting firm. So it's, some things will come in, and maybe the person who has it, I don't know a lot about this. I got to go figure out stuff about Alzheimer's disease because we got a project on that, or I got to go figure out stuff about the aging adult, service connection. Like a lot of it will be, you need to go find something out. You need to go figure out a little bit about that topic, and then, become an expert on it, and then be able to write about it. I think it's a little bit more fast paced than some of my other friends that I know that have jobs at other places. I would say that that's one of the main challenges that I had to get used to. I had to really think on my feet when I first started. And thankfully, I had a lot of the skills already. So I was like, okay, like I know how to do SAS analysis. So like that was my main starting point when I started, is I did all the analysis in SAS. I was like, okay, well, I know how to do that. So that's fine. Yeah. And I can read up on all this other stuff. But yeah, it's a little bit faster, I think, in the consulting world than it is at local public health agencies, which have a little bit more like, because it's, funded through these big grants that it's like government money. I think there's a lot more like, we have to do this, we have to do this. Whereas like consulting work is kind of like, we got this project. All right, we need you to jump in. We need you to write something really fast. We need you to do some analysis on this. So it's a lot more fast paced, I think, than some of the stuff you'd see like in government work.
How do you prioritize your time? Because that does sound very like, just hearing you talk about it, I'm like, whoa, I don't even know what I would do.
Yeah, it's a lot of coordinating, I would say. Okay. So I really have, like, week to week, I have to be like, okay, here's my main like data priorities that I have to finish this week. Like, so I was on this big project where I had to do all the survey management and data management and methodology for like this big survey that we do every year. So that one was big. And I was like, okay, I have, XYZ deadlines. So I have to get this one done first. So it's kind of like, prioritizing what is the one thing that is coming up first and having to get that one done first. But I think I really thrive in this environment because it's like back and forth. And I really love how the variability day to day, because it's not the same every day, which is what I really like. And so I think being effective at being able to be like, this is where this space here, I have to get this done in this hour and a half, and like really sitting down and finishing one thing first. Because I think sometimes it's like you get too much going on. So you kind of work on something for a little bit and then you like have to switch gears and work on something else. But I'm really good at sitting down, finishing something in 2 hours and then moving on to the next thing. I think it's like getting that one thing done first and then moving on, I think is really helpful in my work.
Yeah.
And just prioritizing the things that are done at the end of the week, because it's kind of deadline based, like journalism. Like I have to get this one out by Friday, so I'll do that one first, and then the next thing is the next week. It kind of falls into place, I think, once you get started, and once you're here for like 6 months. I think it was kind of stressful for like 6 months. I was like, I don't know what's happening. Like, what do I do here? But then once you kind of get that first 6 months out of the way, I think at any job, it's kind of like now know where stuff is and you now know how stuff works. And I think that's going to be wherever you go. I think like the first 4 to 6 months are just you trying to prove yourself in the job. And then once you're like, okay, like they know I know what I'm doing. So now it's like, now I can focus more on the work instead of like trying to be like, I'm smart, like I can do this, which is, I think, the first 6 months. So if you feel a little, frazzled in your first job, I think that's everybody. Like, it's stressful, especially we've been doing school for so long that it's like, okay, now I like work and like get paid to do this. Like it's different.
Yeah. And it takes time to just get into a rhythm with the job.
Yeah, exactly.
I always tell people it takes about a year to get comfortable in a job.
Honestly, yeah. You feel like you know everybody, you know who to go to for stuff. I feel like that was a big thing too. When I first started, I was like, I don't know about, this topic, like who do I talk to learn about that? Like that was a big curve, I feel like, too. Just like getting used to, who knows what in your agency, I think is really important.
Yeah, no, that's a good point. What about your biggest success or biggest thing that you've achieved, or thing that you're most excited about that you've achieved in the last 2 years?
Yeah, I think like, so when I first started, I really wanted, I wanted, coming from biochemistry, where it's like really, really, it's very micro, like we are working in a test tube and I'm like, it's very small and it feels like, where does this go? And in public health, I feel like it's very macro, like you see these things start to finish, and you see like a policy initiative, and then you see the program that's developed from that policy, and then you get to actually evaluate that program at the end of the day and see if that program is actually helping anybody. And like, I've been on several projects where I've gotten to do that, like where I get to like, we develop the scope of work, we do the analysis, and we actually get to say like, here's some gaps and here's some successes of this program, and here's what we can do better next time to like better serve these populations. Like we did a really cool needs assessment for the state on veterans health. Like that one was really meaningful. Like we have a lot of gaps in services and we need to address, and it was really, really awesome because it's like this population that's important. Like we get to see these different populations that we talk about in school that we know are like, we are leaving people behind, like some of these systems. And we get to actually be some of those, like, I'm a person that gets to go in and like, we can, focus here on this issue and try to fix it. And that's like super meaningful work. And like this year, because I love data and I love, survey development, like I got to work on the development of a survey, and I got to like do the data management on that survey when we got the data back, and I got to like write the entire thing, like the whole out, like when we're putting out our data findings at the end of the year, I've been able to work on that the whole time. So like I've been able to be start to finish on like survey development to answer questions about health access and health outcomes in Colorado. And that's like huge. That's so cool. Yeah. I've gotten to do that whole process. And like, that was something when I started, I was like, hey, like CHI, you have a really cool survey. Like, would I be able to work on that someday? And like 2 years later, I got to do the entire thing. Like it was super cool. So like, there's so many opportunities if you just ask, and if you just are interested in something, I think you can people can help you find those interests, and people will put you on those projects if they know you're passionate. That's something I found at my job.
Yeah, that's really awesome. That's really, really cool. Okay, last question. What advice do you have for any prospective public health student or the future public health career professional? What advice would you give them?
I think like one thing I really tried to do during my program was like, I want to say yes to lots of opportunities. Cause like starting off, I was like, I know that this is cool, but like, what's my passion about this? Like what kind of things, like, I didn't know what kind of avenues were interesting or like something that I thought was interesting in public health. I just knew like, this was cool and I want to help. And I want to like, use my math and whatever to answer questions for people. So I think like one thing I really tried to do was say yes to a lot of opportunities, like got a job as a graduate research assistant and then figured out like, oh, like maybe research isn't quite what I want to do. Or like maybe, some of my friends were like, oh, this is really cool. Like I really like doing public health research, which is different than, working for a local public health agency or working for a consulting firm. Like I think the best thing that you can do is really try to use the connections that you make at the school to get involved on different things to see where you want to work or what kind of work you'd like to do. Because it's really hard because public health is so big that like you can work on such a small, like, injury, like accidents, like there's a lot of different topic areas that you can do, foodborne illness. Like, and I think just saying yes to a lot of opportunities that you find that you will find through the program because they're always there.
Yeah.
And then like doing that for 6 months, doing that for 3 months, and just really seeing like, where do you, what crossing off what you don't want to do, which is just as helpful as finding what you like. And then just really, going all in on the practicum experience, like finding something and just like, going with that and seeing where that will lead you. Cause for me, it wasn't just the summer. Like I did it through the summer and then I had a job for an entire year, like where I got a year's worth of experience during my MPH. So like, I think the practicum experience and the final project were so important because at the end, when I had my final project, like I used that during interviews, like they were like, hey, present on something, because that's some of the different interviews are like, have you present on a topic because because I don't know why, but I had a whole, I had a whole presentation already done and I already knew all about it and they thought it was really cool. So
Yeah.
all of those different experiences really set me up for success to find my job, because like I knew what I was doing by then, because like I had already done it at my practicum experience, or like that kind of stuff. Like everything I learned during my practicum experience that year set me up to like, I could start my job and I knew where stuff was. Like I knew where the data was, I knew what the data was and what was available because of that experience. So I think that was huge. It's like go all in on the practicum, like figure out, find something cool and try to stick with it and try to like make it longer than just the summer, because then you can learn so much on the job. Like, cause that's what's hard is like the on the job experience. I think that was the most helpful thing that I did that last year of my MPH.
Yeah. Yeah. And I like how you mentioned bringing it up in your interviews, because having that practicum experience and if part-time jobs, while you're in the program is really what you lean on in your interviews, because that's your experience. And that's, you know, what helps you answer their interview questions.
Yeah. And I was able to bring like physical copies of like, I did all these 1-pagers for Tri-County about substitutes, and I like would bring them physically to my job interviews. And my current job was like, that really stood out. I was like, here's something I made. This is something that like I did in public health. And they've like, he's one of my, who I work with now, he was on the hiring committee. He was like, that stuck with me so much because like you brought products with you that like you are the work that we do here. Like you were prepared with stuff that like I could prove that I know how to do this already because of my practice experience. Like it was so helpful. And
wow, that's really good. Yeah, no, that's a really good idea too. And most jobs in public health ask for a writing sample or a presentation or something like that. Yeah. So that's great.
Anything you can do to like set yourself apart with those kinds of products, I think is really important. Yeah.
I completely agree. I think it's almost important to maybe even start creating like a portfolio while you're a student.
Yeah, that's a good idea.
Yeah. All right, Lindsay. Well, thank you so much for sharing this information today. And of course. Thank you for all the amazing work you're doing in public health.
It's been fun. I really, really like my job. So like, I'm more thankful than anything that like I did that experience and now I get to do really cool work. So
I'm excited to see where your career goes.
Me too. Yeah.
All right. Have a great day.